let's look at healthcare from the consumer point of view, not just the medical need point of view. In the old days, ask your grandparents about this. Not even your parents anymore, but it's drifting into the fading fog of old history. Your grandparents remember a time when any job will guarantee health insurance. And it was not bad. It wasn't great, but it wasn't not bad. And that was actually the standard of healthcare availability. And people assume that. Well, we don't live in those times anymore. First of all, the employment situation is now gone completely chaotic. Nobody can really expect a lifelong job anymore. It's a very rare job, a lucky person to find a job where they are safely and reliably employed in the same company all the way up to retirement, and then they get a gold watch as a retirement gift. Those days are long gone. And then even to get corporate health care now, the quality of this health care is starting to drift. One of them being that medical care is just skyrocketing. The cost of medical care is spiraling out of control. Everybody has their pet theory of how to fix it, but nobody can agree how to, but everybody will agree it's broken. So well-meaning, good intentions of providing health care to employees is coming up against the hard reality that corporations and even governments are having difficulty affording it. And how about you? What about the average individual who doesn't get corporate health care or government health care? How are you supposed to get health care? And we're going to talk about these issues in this lecture. So one of the principles of reducing your healthcare cost is to prevent you from getting sick in the first place. Staying healthy, exercising well, eating well, don't do stupid things. It has costs. Healthy food is more expensive. Gym memberships are expensive, but it's nowhere near as expensive as you going off and getting heart disease, getting lung cancer, and now your medical bills will bankrupt you. So it's much more cheaper. It's also more fun. It's nicer to not get sick in the first place, and that's prevention. And that is the focus of prevention. And that's even a focus of health insurance. Health insurance is designed to reward you for getting preventative care. And yes, they will pay for medical bills after you get sick, but you will come up against a bureaucratic nightmare trying to get reimbursed for these high-ticket medical expenses. For every health insurance plan you're a part of, there are these programs in there to encourage you to go get checkups, get preventative care so you don't get sick in the first place. One of the ways to reduce your risk of getting sick in the first place is follow your doctor's advice. But that means getting to a doctor. So getting a regular annual checkup if you have nothing wrong with you, and if you complain, but I have nothing wrong with me, that is the best time. That is the best reason to go see a doctor at least once a year to make sure it stays that way. Because despite despite your whatever philosophies, there are diseases that rumble along under the radar, out of sight, undetectable, because of lifestyle choices, environment, and then until finally it becomes serious enough that it's detectable by expert physical exam and blood tests, but you still can't notice it. And that's the window of opportunity for the doctor to find it and to tell you, whoops, what's this? What's this asterisk on your blood lab? I think this is what's going on. This is something we need to keep an eye out for, and now you really need to start taking better care of yourself. Because if you don't, this thing will start becoming noticeable. You will start feeling it a few years down the road, and then we're going to have to switch to medication. And then if that doesn't work, we may have to switch to like invasive intervention like surgery. So don't go there. Don't end up there. Take care of yourself, get regular checkups, and then if anything is found, like snip it off at the bud, which is a phrase, or head it off at the pass, which is another phrase. All of it just saying like get in ahead of it. Prevention is easier than cure. Right. If you end up being a patient in any kind of context, then you should know that there is a Bill of Rights. And here's like a select few of them. It's not the complete list. And your homework assignment will be for you to go out there and find it. It's not hidden. It's supposed to be easily found so that patients can easily find it, so they know what their rights are in a hospital, in a clinic, in an ambulance, and then they can stand up for themselves. The days of doctors knows best, just shut up and listen and do what the doctor tells you, those are also long gone. Those are from all the way back in the 1950s. But since then, the public has become more aware, and lawyers and lawmakers have followed suit that no, doctors are not perfect. They are human beings after all. They make mistakes. They have conflicts of interest. They also sometimes dozed off in medical school lecture. They also sometimes procrastinated when they were supposed to be studying, and then crammed just before an exam, and then after the exam promptly forgot what they studied, because that's what cramming does, just like you do, just like I do. So just because they have an MD after their name doesn't mean they're a walking encyclopedia. Some of them are, but not all of them are walking encyclopedias. So when a doctor says, I think you should do this, you have a right to a second opinion. You have a right to have authority over your own care. You have a right to refuse care as long as you're not a danger to yourself or others. Of course, you have a right to privacy and confidentiality. That is now codified in law. And if you're a healthcare provider, once you become a healthcare provider, you'll know all about that. So here, these are just a few, and your homework assignment is to look them all up and list them all. List them all. Oh my God, what do you think? I have all day to do this? Well, you have copy and paste now, right? So it's simply a matter of looking for it. I will know if you used artificial intelligence, because there will be like items there that make no sense to me, because I know what the answer is. It seems logical to you because you don't know the answer, so whatever the AI comes out with, you'll say, oh, look, sounds good to me, but then I'll read it like, where the hell did this come from? You must have used AI. So I'll double check your sources. Okay, so confidentiality, privacy, that's HIPAA, H-I-P-A-A. Pro tip, HIPAA is spelled H-I-P-A-A, and that's all that most healthcare providers use. Many healthcare providers cannot quote the full name when you stick a microphone to their face. They cannot actually say what it actually is. Health Insurance Portability Accountability Act. It's as young as 1996. So wait, what did they do before that? They just violated patients' confidentiality left and right. They would be in an elevator, a public elevator, like doctors and nurses would be in a public elevator talking about a patient with like total strangers in the elevator. So this law was sorely needed. Anyway, you have a right to protect your privacy, protect your confidentiality. They cannot talk about you in the elevator. They cannot do this, they cannot do that. So that's HIPAA. So pro tip, it's H-I-P-A-A. It's not H-I-P-P-A. I've seen nurses and paramedics spell it H-I-P-P-A. And I think I know why, and I'm just here to tell you that HIPAA is not a female hippo. Just think of it that way. HIPAA is not a female hippo, it's H-I-P-A-A. Some definitions now, I think you know this. Inpatient means you are you are admitted into a hospital and you stay overnight. That's inpatient. They set you up with a hospital bed. They put the thing around your wrist, the plastic band that identifies you, and it's a pain to cut off, and it's supposed to be. It's not supposed to be easily slipped off. That's how we make sure you are you, and we don't give the wrong medication to the wrong person, etc. Outpatient is you don't stay overnight at the hospital. You just visit for the day. Maybe only for a few minutes, from a few minutes to several hours. Anyway, you're not staying overnight, you're going home afterwards. That's outpatient. And then not even coming to the hospital, but having the healthcare provider come to your home, that's home healthcare. Allopathic is the name for traditional Western medicine, who, if they have an MD after their ID badge in a hospital, that is an allopathic medicine. That is just the name, that's the category. Because any other doctor, any other healthcare practitioner who is not an MD is something else. And that something else is called was starting out as alternative medicine and is literally non-allopathic. Alternative medicine was the old way of saying miscellaneous or anything else, non-allopathic. Did not go to a 4-year medical school, a medical school that was certified, credentialed by the American Medical Association or the country's medical association. Did not go to one of those places. They went to some other school that does something differently, and that is anything not allopathic is alternative. Nowadays, it's called complementary, and I'll talk about the difference soon. When you are talking to your healthcare provider, you may come across the word nosocomial or iatrogenic. That both means a mistake was made. A mistake was made. So that's a fancy way of saying, oops, sorry. So how can a mistake be made? Well, they're humans, right? Healthcare providers are humans too. Humans make mistakes. The subtle difference now, nosocomial means it happened in the hospital. Iatrogenic means it happened because of a provider. The healthcare provider screwed up. They made a mistake, whatever, and so they caused the mistake, whereas a nosocomial means it happened in the hospital. So the hospital as a system made a mistake. What's an example of either? So if a surgeon takes out the wrong kidney, all right, that's iatrogenic. If you got an infectious disease in the hospital, that had nothing to do with why you ended up in the hospital in the first place. You were there for a broken leg, and then you got bloody diarrhea because you were eating the hospital food, and it turned out it was contaminated by Clostridium difficile, which tends to make its run through hospitals. So the fact that you were in that hospital means you got the bloody diarrhea. That's nosocomial. Autonomy is part of that patient rights. You have a right to take care of, to be in control of your own body. You have a right to make decisions for your own medical treatment. And it sounds so obvious now when we think about it, but there are times when people were forced to undergo a treatment even though they didn't want to, and they were sound mind and judgment. So part of HIPAA was to reinforce that you have autonomy, and it's in your patient bill of rights. Which means, and it's more involved than it sounds, because like back in the days when the doctor said, do this, I'm telling you to do this, you have to do it this way, and everyone said, okay, doctor. So those days are long gone. Doctor can no longer order a patient to do anything. They never could, but they could sort of like gaslight the patient into like browbeat them or like pressure them into accepting treatment, only because of like the sense of authority and reputation of the doctor. So it was like the doctor was in charge of this situation, and now the principle is the patient is in charge of the situation. Yes, I know you don't know what's going on, you don't know how the disease works, you don't know how the therapy is supposed to help, but the provider is supposed to explain everything, and then the patient gives the final go, no go decision on it. And if the patient says, I want to talk to somebody else, I want a second opinion, then absolutely the patient has a right to do that, as long as they're not a threat to themselves or others. So, I mean, if somebody is like shedding typhoid infection, you know, with everything they touch, and then they say, I don't want to stay here anymore, I need to go back to my job. So what's your job? I'm a fast order cook at the diner. Like, no, you cannot go. You're going to cause a typhoid outbreak in this city. So no, and you can't stop me. Oh, yes, I can. You are a danger to others. So if you're not a danger to others and to yourself, then you have the freedom, and part of being not a danger to yourself is you have solid and clear mental thoughts. You have what the legal world calls a decision-making capacity. Then the hospital has to let you go. They have to let you discharge. But then here is that if you're a danger to yourself or others, then okay. What about if the patient is unconscious? Unconscious is actually a generic conversational term. In medicine, we call that unresponsive, or any other altered mental status. Well, then they no longer have decision-making capacity by law. It is a legal term, decision-making capacity. The patient can no longer decide, and now the hospital has to do what they think is in the best interest of the patient and the general public too. You may hear the word triage, and that is, enable editing. Okay, they see the word triage. Sometimes the number of patients overwhelms the local healthcare resource. Like, well, EMS, we deal with triage often. We get called to like an overturned school bus, and we show up and there's like 12 kids and the driver all injured, and the car that ran into them also had passengers and they're all injured. Now what do you do, right? It's just you and your partner. What are you supposed to do? Are you supposed to like run to the first patient and take care of them? Or are you supposed to go to like the closest seriously injured patient? Or what about all the other patients? So the first thing they have to do is triage, which is decide rank everybody there in levels of severity. That way they can get on the radio and say, I have 5 green tags, 3 yellow tags, 4 red tags, and 1 black tag. So that's, I'm going to need this many ambulances. And that's really the best thing to do for all people involved, to find out exactly how many ambulances are needed. They can't say send everybody. You cannot get on the radio in New York City and say send all ambulances, because there's like 100 or 200 ambulances. You only needed this many. So that's really the best thing you can do. And it sounds really cruel to like identify the first person right in front of you as, okay, that's a red tag, and then like step right by them and like walk right by them to the next one. Like, what about that guy? Well, I gotta triage first. When you show up at the ER and you explain your condition to the triage nurse, that's what that nurse is doing also. They are grading you on how severe your situation is. If you are like dying right now, then they will rush you in. If you're not immediately, if you don't have an immediate life threat, they'll say, go sit over there. But I broke my arm. I know, sit over there. And you could be waiting for like hours. And that's why the last time you went to the ER, your wait time was so long. How many of you was in the ER waiting room? Was ever in the ER? First time, how long were you waiting before a doctor finally saw you? 2 hours? Okay. And how long were you waiting? 3 or 4 hours. That's very typical. So you can look at it as like, why am I being treated like this? You know, I'm sick. Why don't they come see me? That's one way to look at it. Another way to look at it is, okay, I guess it's not that bad. Because if they rush you in after you explain what's going on, if they go, okay, come here, go to Bay 12 right now. Okay, something is very, very bad going on right now. Now it's the time to like really worry. But if they say, go sit over there, okay, so that should give you a feeling of like, oh, I guess it's not that bad. It can wait. Oh, I was afraid it crashed. Consent. This is something so I should explain this a little more detailed. So part of that patient autonomy is you have a right to have everything explained to you fully to the level where you understand what's going on so that you can make the best decision for yourself. And then you give permission for the provider to continue, and that's consent. The best kind of consent is informed consent, which is exactly that. No matter what your level of education, how much medicine you actually know, and assuming you know nothing, then the provider has to explain it in simple terms in your native language, if at all possible. There are translators available in hospital to the most common languages in the community, and they have to explain exactly what's going on, what this treatment they're about to give you will do, what are the benefits of it, and what are the risks. And they can't just say the risks are minimal. No, that's not going to fly. They have to explain, like, itemize it, like this could happen to you, this could happen to you, this could happen to you, and then at various levels of severity. You could have tingling on your tongue. You could get a headache. It could be serious. There is a certain percentage of death from this therapy. And then you decide now, the treatment is this important for me, but there are these risks. And now you have all the information you need to give the go, no-go decision, and that's consent. You give consent to. Now, has a provider, like a nurse or a medical assistant or a clerk, ever really done that to you? And I'm not going to take a survey because I'm afraid what you'll answer, but something tells me many of you have experienced the situation where they just shove a piece of paper in front of you, say, sign this. And that was like all the informed consent they gave you. And you can complain and say, you're not explaining this to me, and they'll roll their eyes and go, okay. And they have to explain it to you on request. And so why do they do that? Well, humans are humans again. It's on the other side of that counter. This person is treating it like just a job, and it's very, very busy on the other side, and they're trying to get stuff done. So, the theory hits reality. But anyway, if you ever show up at the ER and they give you a stack of papers to sign and initial and sign and initial and sign and initial, that's all about consent. Consent to do this, consent to do that, etc. Express consent is what you give, and it's some meaningful gesture. It doesn't have to be verbal, but it's some meaningful gesture that you make to say, okay, go ahead. Now, preferably written would be best. A signature on a legal document would be best. But if you ever was waiting in a clinic room and the nurse came in to take your blood pressure, or the medical assistant came in to take your blood pressure, and then they say, do you mind? And you just stick your arm out and look away. There, you just gave express consent. So now, what if the person is unable to communicate at all? They are unconscious, or they are altered mental status, like diabetic, now is like completely confused. You can't get consent. They don't have the legal decision-making capacity. How are you supposed to take care of them? If somebody is like on the floor, no pulse, how do you know you got consent to start CPR, compressions? not just a experienced healthcare provider, but like a bystander who happened to be trained in CPR, how are they supposed to know that the patient isn't, if you save their life, they aren't going to turn around and sue you for touching them because you violated consent? And there's this concept of implied consent. Implied consent means, legally, the definition is any reasonable person in that situation would have wanted you to help, to save their life. Do what you got to do to save their life. It will worry about like the side effects, the consequences of your actions later. That's implied consent. That way, if the patient later wakes up after you save their life and they try to sue you, and like, why'd you touch me? And well, you can argue implied consent. And that's basically going to cause the judge to look at the patient and say, well, did you die? You're alive now. So that is the principle of implied consent. Good Samaritan law. So, this is for non-health care providers or providers who are off duty. There. Because when a healthcare provider is on duty, then they are legally protected by their medical director's malpractice insurance. Once you clock in, the doctor's malpractice insurance covers your activity. Once you clock out for the day, you're just another bystander. You're just a civilian. So, to address the fear of being sued by the patient, Good Samaritan law protects you under these 4 conditions. You act only within your level of training. You see somebody is having an severe allergic reaction, so you whip out your pocket knife, you cut a hole in their throat, you stick a McDonald's straw in there so they can breathe, and they say, where'd you learn to do, how'd you know to do that? And you say, I saw it on TV. Okay, Good Samaritan law does not protect you. You are practicing major surgery, and you're not even a doctor. So you must stay within your level of training. So if you know first aid, you can give first aid. If you know CPR, you can give CPR. If not, you really should stay back and call 911 because you know how to use a phone. You act in the best interest of the patient. So what does that mean? Like, you try to do the best. You don't do this with ulterior motives. You don't do this with adversarial motives. You cannot be compensated. This is very important because if you are, like anything, cash, quid pro quo, which means I help you, you help me. Let's say you did the Heimlich on somebody and then they said, wow, you're the right guy at the right place. God must have sent you. Here's $20 for your trouble. Technically, once that money touches your hand, then 5 seconds later, they can say, oh, by the way, I think you broke a rib. I'm going to sue you. And you are wide open, vulnerable, because you accepted money. So the Good Samaritan law is now void for you. By the time I upload this revised PDF, then I'll probably remember. If not, on the way there, on the way to the end. Okay, beneficence is another word and means you act in the best interest of the patient. Why would you not? Well, you know, people are people, right? Some people can be quite dastardly, can be a real son of a bitch. So you have to act in beneficence. Similarly, on the flip side, you can first do no harm. This is famous. You maybe have heard of this phrase many times before. Healthcare providers hear it all the time. First, do no harm, which means do not act in a way to worsen your patient's situation, and that's non-malfeasance. Four qualities of a proper healthcare system are these. And so I'm not going to read this to you. You can read. I think these are self-explanatory, but these are the four separate quality attributes of a good healthcare system. And I don't think you have to look very far to find a system that fails one of these things. Maybe even in your local neighborhood. So it's something that requires eternal vigilance. It's like it takes hard work by all parties involved to maintain these standards. Because if somebody cuts corners, starts slacking, gets lazy, then one or more of these corners start to crack. So allopathic medicine is the traditional Western medicine. It is the one you all expected. It started 2,000 years ago or more in the basis of Western civilization, and then it really took off in the Renaissance with the creation of evidence or research. So before the Renaissance, it was all about, what God wanted, the spirituality, make your best guess. But then once science really took off, the principles of science took off, then the focus shifted to evidence-based. So don't just tell me what you think should be true, like prove it. Go out there, do the research, and then after it's shown to help more people than not, and like overwhelming numbers, then we can adopt it for our hospital here. That's evidence-based medicine. What's a way to know, what's something that can throw off your research results to make you think something is true when it turns out it isn't, if you just did a research project properly? And a big one is the placebo effect. It's everywhere. It's not just a real pill and a fake pill. It's the presence of somebody in a white coat with a stethoscope and gray hair and a gravelly voice. That just the presence of a person like that, fits the picture of a kind and wise and knowledgeable doctor. That can influence people to feel things that they otherwise wouldn't. The placebo effect is powerful. It's everywhere. So if you're going to run a research project, you have to control for it with a blind. That's where you do the fake thing to half the group, the real thing to the other group, and then see if what you think is such a great idea actually works. So that's part of evidence-based medicine. Anything else is alternative. Now, alternative was the original phrase for anything non-allopathic, but alternative started to get this bad reputation because if it's anything else, just the concept of a category that's everything else will include con artists, liars, fakers, snake oil salesmen. It includes the entire range of human experience and intention. So yeah, a lot of fakers, a lot of bad or faulty medicine was getting lumped into this alternative medicine. And just the phrase alternative means alternate, means like other than. And so there were people going to alternate medicine care instead of a regular doctor. And so there was that other reputation that if you go to an alternative medicine provider, they're kind of suggesting you stop going to a regular doctor. Don't listen to what your doctor told you. Don't take the medications that he prescribed. Don't get the surgery. Just just believe in us and we'll take care of you. And so together, the bunch of quacks are mixed in with the good people. The bad egg, the rotten apples are mixed in with the good apples. And then the implication that you should not listen to your regular doctor, like many influencers on YouTube are trying to do now. They're trying to tell people, ignore what your doctor is telling you, believe me. Like, who the hell are you what is your credentials? What is your experience? So that was this bad reputation was growing for alternative medicine. So there was a subgroup under alternative called complementary. Now, the spelling is important. Complementary with a E. Because if you use the word compliment with an I, it means you're saying something nice. Like, oh, you look nice today. I just paid you a compliment. But complement means matching, being like a matching fit to another thing. When I compliment you means those things that you're weak in, I'm strong in. Those things you're strong in, I'm weak in. So together we make a great team. That's complement. So complementary medicine providers are saying, no, we don't say don't go to your regular doctor. Of course, go to your regular doctor, do what your doctor tells you, follow their advice. But then if there's anything like missing, something that you wish was different about your current doctor, then we can fill in the gaps. That's complementary medicine. One thing that complementary medicine does a lot of, which seems to be missing from allopathic medicine, is that they are more holistic. Holistic means look at the big picture, look at the whole patient. For example, allopathic medicine, your typical doctor's visit, for those of you who are just there for a checkup, not for like something ongoing and serious, but if you only go to your doctor for your regular checkup, how long do they spend with you? 20 or 30 minutes? Yeah, lucky man, a whole 30 minutes? What do you want, a Beverly Hills plan? What, anybody else have what's a typical amount of time? I'm not talking about the wait time, like 3 hours at the waiting room. But once they see you in, how long does that doctor actually spend FaceTime with you? 2 to 5 minutes. That's pretty short. 5 minutes.
That's quick.
Like, that's barely enough time to say, how you doing? Okay? Anything wrong? No? All right. See you. Oh, okay. That's pretty short. How about you?
For me, it's usually like 15, 20, but it could depend if you already have like pre-existing like medical condition. You gotta like check up on that.
Right. That's why I said if you don't have anything serious going on, you're just there just to get a checkup. So yeah, 15 minutes is the average, and then the more things going on in your life, the more. But so they go, how you doing? Anything new? Talk about? How is that? And then they like maybe they talk about, they review some of the stuff that's happened since then, you know, any recent tests or results or like that. But that's it. They're in and they're out. And the main reason for that, the reason why they spend so little time with you is because they are very expensive. Doctors' hourly rates are like the most expensive in a clinic. And so in order to run this business, because we are in a capitalist system, whoever's running that clinic is trying to get the maximum utilization of the resources. So they just want to use the doctor to get some quick overviews, and then use the doctor's authority to write prescriptions and order labs. And then he's out and he runs across the hallway to the next patient's room. A lot of the interaction happens with a nurse who takes your vital signs, the medical assistant who guides you. You know, the nurse also is paid a certain rate. So to help the not waste the nurse's time, they hire medical assistants to do the things like chaperone, set up the examination room, give the patient some something to put on if they need to disrobe. So all of that nitty-gritty stuff, because the medical assistants are paid very little in the totem pole, in the hierarchy. So it's all about saving money, this capitalist system. And so if any of you ever felt like you were on an assembly line or you were a box on a conveyor belt, it's not a coincidence. Because somewhere up there in the corporate medical system are a bunch of MBAs trying to figure out how to maximize profit, minimize cost, in order to throughput the workload, the work in progress through the system, like you were a box on an assembly line or in a conveyor belt. And people walk away from their regular doctor's appointment feeling like just a number, feeling like a box on an assembly line, which is where they, and then if the doctor is, so their doctor shows up and says, how you go? And you start to tell them about, oh, I had an argument with my dad today, wants me to go to grad school, and I'm tired of school, I want to go out there and get a job. And then the doctor's going to go like, I was asking about your foot, but, thanks for sharing, but I really want to know about your foot. So your regular doctor, your MD doesn't want to hear that. Doesn't want to hear the stresses you are having at school, other than the simple fact that you're under stress. That's it. They just want to hear you say, I'm feeling stressed. Oh, okay, gotcha. And then they'll talk about stress. Very shortly, but they don't want to get into the details. With holistic medicine, they do want to talk about how are things at home. They do want to talk about the stresses you're getting at work. They do want to talk about your relationship with your father and your mother and your siblings and your significant other. They do want to hear all that because they're looking at the entire body, and because they are very much in the health is a triad of three things. Right, that's redundant. Health is based on wellness in three areas, which I talked about at the first lecture this semester. Anybody remember what those three are? It's not just the absence of complaints. The physical side. What's another one? Mental side. Now you know the pattern. The third one? Social, right. Physical, mental, social. So yes, holistically, they do want to know what's about your relationships with your family. They do want to know, are you getting along with your friends? Do you have high quality friends? It's more important, by the way, to have a small number of high quality friends than lots and lots of shallow friends. And follow that analogy. It doesn't matter if you have 100,000 likes and subs. It doesn't mean you're a good person or you're doing all right. In fact, the opposite. So that's the holistic approach. But guess what then? You have this in-depth conversation about your life, your hopes, your dreams, your fears with this person. You walk away feeling heard. You walk away feeling like somebody actually listened. You were not a box on an assembly line. You were actually, you felt like you were treated like a human being. That is the real draw of complementary medicine. So I'm going to talk about a few other of the different kinds of complementary care therapies. But remember this, that each one of them takes the time, spends an hour with you, maybe 2 hours if you paid enough, depending on the service. And you walk away feeling, they walk away feeling like this person really cared and wanted to know about me. So that is the real draw of complementary medicine. I said that complementary and alternative medicine is is the entire range of human behavior, from con artists and crooks all the way up to like genuine angels who are there to make the world a better place, and everybody in between, the entire range in between. So here's a couple of examples. Osteopathy is complementary because it started out that way, and it's DO, which is Doctor of Osteopathy, after their name. So if somebody says DO on their ID badge, don't say, "Get the hell away from me, you quack," or you crazy hippie. No, actually, osteopathy is highly respected here in the U.S. Osteopathy is one of those complementary medicine professions that actually prove themselves, to the point where DOs actually work alongside MDs in New York City hospitals, and they are considered the equivalent there, at least first-year residents. Sometimes osteopaths just stick around at the first-year resident level, but that's the old days. I don't know about now. So osteopathy has proven themselves. They started out all long time ago as focusing on bones, and the holistic focus on the whole person, but but just, after all, health is not just physical complaints. It is physical well-being, mental well-being, social well-being. So they were not wrong to focus on the whole person. And they have expanded out to all of the topics that a regular allopathic doctor covers. So that's why they're highly respected. Chiropractic, not so much. Chiropractic also deals with bones, so it's understandable that people would confuse the two. Chiropractic is not generally accepted, recognized by the greater medical community as like something that really is a thing. They do have clinics, so you don't really see chiropractors in hospitals. Instead, they go off and make their own little small business. They set up a clinic, they set up a store, put a name on the front door, and then spread their business by advertising and word of mouth. So why is it so popular though? Why do a lot of people go there? Well, it's complicated, but part of it is the holistic approach, treating an individual as the whole person, so people feel like they were heard. They have this great interpersonal experience there, but also they're famous for like cracking the back or popping the back, like when you're cracking your knuckles. Can I still do that? I haven't cracked my knuckles in decades, so my knuckles don't do that anymore. But that satisfying you just did it. That satisfying feeling when you pop your knuckles, that's what people feel in their back when they get cracked. And they think, oh, I feel that was nice. Okay, I feel much better. That sounds like the placebo effect. Somebody in a hospital garbs, in a white room, smelling of disinfectant. So you get the whole presentation, and then something is done to your body, and it feels good initially. So people think, oh, then it must be working, and how do you know that's not the placebo effect at work? And they really don't. So that's a problem. Another problem with chiropractic is that every time when you crack your back, when you have your back cracked, it causes a little bit of inflammation, and your body reacts to that, and maybe you get this warm, fuzzy feeling from the inflammation, okay, but that means that you're gonna need it cracked later. The more you have your back cracked by a chiropractor, the more you need to go back to the chiropractor to have it cracked again. Because, so it's sort of like it conditions your body to need it to keep that spine free and clear. Anyway, supplements. So chiropractor, I guess, like in the lower half of the reputation of alternative medicine. Supplements near the bottom. So yes, those vitamin pills you're taking, those cures what ails you, things on the packages you can buy in the health food store. Also some of these things are available in the drug aisle, in the aisles of the drugstore. Some of it works, I guess, but some of it is just water in a bottle that you pay $20 for. And the problem is the supplement industry is not regulated. The FDA can only check if it actually harms people. As long as it doesn't harm people, and like a bottle of water would not harm anybody, so the FDA clears it because it's just a bottle of water, but it has all this packaging around it to imply with a wink and a nod that it's good for you, and so people take it, and then many people, it doesn't do anything for them because it's just a bottle of water, so they get disgusted and ignore it. But a small percentage, because of the placebo effect, think it did something good, and they tell their friends, take this, it worked for me, it'll work for you. And now, when your friend or close family member, somebody you really like, somebody you highly respect, tells you, take this, it works, that's placebo effect again. So you take it, and now there's a chance that you will feel something, even though there's nothing in it. So the placebo effect is supporting the supplement industry. Such as homeopathy. I used to ask who here takes homeopathy, but I'm about to say some bad stuff about it, so I don't want to embarrass you. But if you do take it, or you know somebody who takes it, see this link. Here's some lines from that link. There's little evidence to support it as an effective treatment, can contain substantial amounts of active ingredients, and therefore could cause side effects and drug interactions. FDA does not evaluate the remedies for safety or effectiveness, and key concepts are inconsistent with chemistry and physics. I won't go into I don't have the time to talk about it beyond that, but here are the two principles of homeopathy, and the end result is that they're selling bottles of water. That's pretty much it. They're selling you bottles of water with lots of fancy packaging and very sciencey terms on the ingredients list, but it's really just bottles of water. And then it's the placebo effect carrying through, maintaining this industry. So how does it stay popular? Placebo effect, innuendo, the people who post on social media saying it worked for me, I never felt better in my life. It's again placebo effect continuing on, and also marketing. So why do people go for these then, even though the word is out there? Well, I think now more than ever, as you go out on the internet, you've seen how disinformation, people manipulate the internet to sell products, to push themselves, to alter people's opinions, and they do it in such an entertaining way that real science cannot compete. It's about as simple as a Hollywood producer, a comedian who is likable, approachable. Their presentations are very professional. They will reach way larger audience than this nerdy, geeky scientist who is trying to stay strictly to the truth. Their statements do not go viral because nerdy, geeky scientists are boring and they say things in boring ways, like me. My videos are boring, cannot compare to the other YouTube videos out there. I don't try to be, because I'm not trying to get subs or likes. I'm just telling the truth as I know it. So you are forced to watch those videos in order to do well in this course. Otherwise, you would not watch them. You would instead watch other videos that are much more entertaining, but are really there to manipulate you. People reach for complementary medicine and supplements because it makes them feel better. It makes them feel like they're heard, makes them feel like they're treated as a human being. And also, complementary medicine is much more cheaper than prescription drugs, visits to the doctor. That's really intimidating. The price of medical care is skyrocketing out of control. The new incoming president has selected various people to take care of different departments, and there's one controversial choice to be in charge of healthcare. And one aspect of that person is hitting the news a lot, but there's something else about it that isn't being mentioned much in the news articles, in that everybody agrees that healthcare, especially healthcare financing, is broken. Now, how to fix it, nobody can agree on. Well, the theories on how to fix healthcare in the U.S. and how to pay for it is split pretty much down party lines. So um, the next 4 years, because this administration will be in control of the presidency, the Senate, and the House, they are now the trifecta. They are now in full control of this country. There's really not many people to oppose them. So anything they want, they will make happen. So it's a wait and see that, well, you can't find national agreement on how to fix healthcare and how to fix financing of healthcare, but one side now has all the power it needs to get their ideas done. Let's see if their side of the story is correct. Let's see if their fixes to healthcare will actually do something, and do something about the price of healthcare, about the accessibility of healthcare. Depending on the kind of complementary medicine that is available, they have different certifying bodies, they have different levels of regulation. Like osteopathy, they are fully respected, they have proven themselves. You can't just go to osteopathic school, it's very competitive. You get out of osteopathic school, you're going to be paid pretty well, so they have to and you're going to have influence over so many people, and especially your patients, that there are some very strict certifying bodies to keep control of it, so that's good. But then what about some other alternative medicine clinics that kind of makes crap up as they go along, and they're pretty much nothing better than a con artist, a thieving organization. And then they'll make up random organizations to claim they're certified, but they're not. They are not real. So how do you know whether this office you're about to walk into is legit? So there are organizations like the National Center for Complementary and Alternative Medicine to keep track of these things, and here's the website. Drugs. So supplements, drugs are not regulated. Buyer beware. If you try to make out what's going on the packaging, be aware that not all, but some of them are just there to manipulate you, to take advantage of your lack of training and education in healthcare. Like, I can read these packages and know it's full of crap, but that's because I have decades of education and training behind me. If you've never thought about healthcare until you took this course, then how are you supposed to know the difference? So research, of course, research on your own is really key. Educating yourself is really key. Just beware, buyer beware. Caveat emptor is the Latin for it, buyer beware, that they're nothing better than some guy at the corner on a folding table selling bottles of liquid. They're nothing better than that. Maybe it's a magic potion and really will cure you, or maybe it's just a bottle of water, or worse, maybe it has ingredients that could hurt you. Just buyer beware. What about prescription drugs, the ones you actually do buy at the pharmacy for too much money, costs a lot, and it's prescribed by your physician? Oh, okay, so the physician should know what they're doing. If they don't, they're going to lose their license. So that's the incentive for the doctor to know what they're doing, because he could get fired if he gives you wrong information. But now, why is it so expensive? Because it's America, that's why. America is on the capitalist system. The drug companies know that, and they will charge whatever the market will bear. Why are Porsches so expensive? Because people are willing to pay it. So why are drugs so expensive? Because people are willing to pay it. And part of it, and it's because of the capitalist system. There are other nations where the same exact drugs do not cost that much, nowhere near that much, because the governments there don't let them. But here, especially thanks to the lobbyists, they are allowed to charge whatever they can get away with. So the pharmacies will say, oh, we have to charge this much because making new drugs is so expensive, it costs billions of dollars, and for every 10 new drugs we research, only one of them goes to market. So those billions and billions of dollars is wasted on the other 9 that turn out to not be usable, not be marketable. So we have to make up our money. Okay, but they do get like $300 billion in profits every year. So that argument is going to call kind of flat. Prevention is the key. Yeah, so this slide is saying you should read this slide, pause the video, read the slide. But the gist of it is that many people try to avoid going to the doctor at all. And then if they get like a twinge or if they feel, so they don't go to the doctor at all, and then through lifestyle choices of eating too much and exercising too little, something starts to grow inside them. Some chronic disease starts to like fester inside of them. And then finally they feel something wrong. But then they try not to go to the doctor because they heard bad things about doctors. Their uncle told them never go to a doctor. It's expensive. Maybe they don't have insurance, so they can't afford it. So what do? They try to ignore it. And then the feeling gets worse. And then they stop at the drugstore. And all the drugstore can do at best is deal with the symptoms, not cure the problem, the root problem. And then it gets worse. So they go on the internet and they look for like cheap or free ways to deal with whatever it is they're feeling. But the internet is full of misinformation. And again, it only deals with the symptoms, not the root cause, because nobody understands it. Maybe it sends them down dead ends, blind alleys, down deep rabbit holes that have nothing to do with what's really going on, because nobody's properly assessing them. And then finally, they have to call 911. They are so sick, they cannot go to work. Out of fear and desperation, they finally go to 911. They finally go to an emergency room where they get the $1 million workup. Because the purpose of the emergency room is to stabilize the patient, to make sure they don't die. That's it. The purpose of the emergency room is not to cure you. It's just to stabilize you so you will keep it together until your doctor's appointment with a specialist, like a week later. But many of these people then who don't have health insurance, they can't afford the clinic follow-up. They just get a couple of pills from the ER to take home with them. The money is billed to Medicare or Medicaid, and then they don't show up for their follow-up appointment, and the cycle repeats. Oh, why go to the hospital if you have no money? So there is a law that says if you show up at a 911 facility, they must stabilize you. They must treat you. They cannot kick you out for the lack of money. It's called EMTALA. I didn't think it was worth mentioning, writing it out, but EMTALA is the law that a 911 ER cannot kick you out because you cannot pay. They must treat you independent of your ability to pay. Now, while you are there, maybe a social worker will set you up with some kind of payment plan or treatment, some kind of like social services program, but you will be treated, but stabilized, not cured. The idea is that you will later go to your clinic follow-up for treatment, for your cure. But then if you don't have money, you're not going to go. And then a couple of weeks later, you finally get the bill. $1,000 for an average ambulance ride, assuming that's to start. $1,000 for the ambulance ride just to start. And then anything they do to you is extra on top of the bill. And then the ER is like $10,000, $20,000. And then every lab is another $1,000 until you're looking at like $100,000, $200,000 bill. This person couldn't afford going to their primary care provider to prevent this from happening in the first place. There's no way they're going to pay for a $250,000 medical bill for one big bad event. So what happens to this bill? Well, the hospital eats it. They're not getting paid. They're not getting any money out of this guy, so they're stuck with this bill. The federal government and the state may try to reimburse them for like pennies on the dollar, but this bill just gets eaten into the profit of the owner of that hospital. Which is why health insurance is so important to have. But it's hard to get. How many of you are on Obamacare? like New York State Insurance Exchange? Oh, nobody? Wow, it used to be everybody a few years ago. How many of you are on your parents' plan? Okay, how many of you are on your employees' plan? How many of you are self-paid? Interesting. So health insurance is expensive, crazy expensive. So, fortunately for me, 2 years ago, I got promoted to full-time here at QCC. So I'm part of the CUNY Health Plan. But a couple of months before I signed the contract to be full-time here, my Obamacare plan sent me a letter saying that my premium is going up to $600 a month. That's insane for somebody who was working part-time like me. So it is insanely expensive. And this runaway healthcare costs are driving middle-class families into bankruptcy, even today. Health insurance was supposed to fix that. What the idea is that you put money into this contract every month, the premium, and then under these fine print, these terms, which I'm not going to spell out because since you have health insurance, you already know what these mean. Just review the terms though, because you could be tested on it. But under these terms, the insurance company will help pay for your medical bills if you get them. But the idea is, but if the premiums get too high, then if you can't afford the premiums, then you're back to square one that you can't afford health care. Here is a hypothetical healthcare company, CFI Care. I don't know what it stands for. It's just an imaginary healthcare company. Just say it 3 times fast, CFI Care. And so this is a company. It's not a nonprofit. It's not a charity. It's a company. They are there to make money, profit. How do they make money? Well, money goes in from the premiums, and then money goes out with claims, and then any other operating expenses. So the more healthy people who keep putting money into the company will bring money in, and then the more sick people who pull money out of the company will make them poorer. And this green health bar here, it indicates the level of money they have at any one time. So how do they maximize profits? Well, they maximize the number of healthy people they have and minimize the number of sick people they have. So before Obamacare, they would do things like refuse to sell health insurance to anybody who had a chronic illness. Cancer, diabetes, asthma, or risk factors for it. Sorry, we're not going to sell you health insurance. Only if you're healthy are you allowed to buy from us. And so people with chronic health care conditions could not find health care, could not find health insurance. That's when Obamacare come in, and that is the nickname for the Affordable Protection and Patient Protection and Affordable Care Act. It said that. Okay, so it created these. It's very, very complicated. It's a gigantic law, but the oversimplification is 2 halves. First, if anybody who wants health insurance can buy it. No questions asked, no physical exam, no conditions. You want it, you bought it, you buy it. You can buy it at different levels depending on how much you can afford, but anyway, that's it. But then the insurance company said, wait a minute, you mean this group here, this number here can go crazy? Anybody who wants to buy my insurance can buy it? Well, then money's just gonna pour out of my company because I'll get like $100 in premium per person, but then people are going to pull $100,000 in medical bills out of me. I'm going to go bankrupt overnight. Unacceptable. I'm just going to quit. I'm not going to be a health insurance company anymore. So the other half is very important. It says, okay, everybody in the country must buy health insurance. So instead of having 10,000 people in your rolls, Now you have 300 million people in your rolls, everybody paying premium. In fact, the federal government will even put money into the company on top of that. There. Now you have enough money coming in to pay for the claims going out, and you can still make money. So you can still be in business. Now is it acceptable? And the nation said, okay, then now it's acceptable. So that was Obamacare. But then, and this is now ancient history, right? But then the next president who came in after Obama fed on the public resentment that people complaining, why am I being forced to buy health insurance? I'm young, I'm healthy, I have no complaints, and it's just taxes. It's just government taxes forcing me to put money into this health insurance company. Not fair, unconstitutional, un-American. And so this president, riding on that resentment, promised that he will get rid of this half when he's president. And he did. And then people said, well, without this half, then the first half won't work. What are you going to do about that? Because there are a lot of people with chronic medical conditions who are worried, wait, this guy's going to take away my health insurance. And I can't afford it. So that president promised he will fix it. He will find a way so that anybody who wants health care can buy it, but anybody who doesn't want health insurance doesn't have to pay for it. What did he do? Nothing. So that is a state of U.S. That's the state of Obamacare today. That is the state of government-provided health insurance. Government-supported health insurance today. You can still buy health care if you want, but nobody has to buy it. So what happens to this idea? As money is pouring out of this company, what can this company do to stay alive? Well, one idea is to raise premiums. Instead of $100 a month, raise it to $600 a month. So if your membership rolls are shrinking as people are not buying insurance, let's say it shrunk by half, then to keep the money coming in, you double the premium, so the same amount of money comes in. So if my insurance went from $200 to $600 a month, that means then that the number of members in that company must have shrank by 2/3. People just stopped buying. And that's why Obama and premiums are just so crazy. I don't know what they are now, 2 years later, but I thought $600 a month was unacceptable, and I was just lucky. I'm not smart, I'm not blessed, I'm not strategic, I was just lucky. It's pretty much like I was standing in the right place at the right time when the cannon shell landed and hit somebody else. It's another strategy. Many companies just quit. Many companies left the market. There are many counties and states in the United States where there's only one healthcare insurance company left. It used to be a multi-competitive market, all competing to lower prices to attract customers. Many places they only have one insurance company left, and now it's become a monopoly, and now they can raise premiums as much as they want because nobody else is competing. So that is what happened. That's what happens when you take away the second half, but you keep the first half. The two most common kinds of healthcare insurances here, it's more it's economies of scale. If you are a health insurance company, another way you can reduce costs is go to each one of the providers and say, I know you're charging this amount per patient, but what if I can guarantee you full activity? I'm going to completely take over your full capacity to provide business. There, do I get a discount? It's like going to a restaurant and saying, I love your food, but it's too much for me. The prices are too high. Can you lower the price for me? And of course the restaurant will say, like, what are you, crazy? Get the hell out of my restaurant. But if you go to a restaurant and say, I'm going to have a party next month. We love your food, but it's a little pricey. I will guarantee 100 people will be there at this party. And that is like 2/3 of your restaurant's capacity. And I noticed that there's only like a few people here at a time. So if I can guarantee your restaurant is now 2/3 full of customers, can I get a discount now? And the restaurant owner will say, oh, of course, sir. Yes, absolutely. We'll give you this much of a discount because it's guaranteed business. And that's how health insurance negotiates prices. And the HMO and the PPO is like variations of that guaranteed business. The more business you guarantee a provider, the more discount you make. But some people say the HMO is too strict. I don't like the doctors in network. I wish I could go to another network. Tough. You're in this plan, you got to use these doctors. So if you want a little more flexibility, unfortunately that means that's less guaranteed customers for the provider. So the discounts are less. So the PPO has more flexibility, but then you have less, then your insurance premiums are higher. Medicare versus Medicaid. Medicare is for Americans over 65, and that sounds like free health care. Of course it's not free. Somebody has to pay for that, and it came out of your taxes. The next time you get your paycheck, take a close look at those things that were taken out of your paycheck before you have your money in hand. There's like tax withholding for federal and state, local, but then there's like a bunch of other letters. One of them is money taken out to pay for Medicare. Another one at the state at the state tax, some of it is paid for Medicaid. That came out of your taxes in order to pay for these people over 65 for Medicare, and people under a certain income level for Medicaid. I was on Medicaid for a year when I was a paramedic student. Convenient, actually. I didn't pay a single dollar in premium that year. Very nice. So all of you taxpayers, thank you for paying for my health insurance for that 1 year. Right now, I should thank my students because their tuition's paying for my health care now with CUNY. TRICARE is for military veterans, and of course we should take care of our veterans because they risk their lives for this country. Okay. Is there another way to do this other than the pure capitalist system? And the answer is universal health care. The U.S. capitalist healthcare system is the most expensive healthcare in the world. Does it make it the best? And the answer is no. Running out of time, but the quick answer is no. We're ranked like 32nd in quality of healthcare. Like if you bought the most expensive baseball team in the world, shouldn't you have the best baseball team? Like the Yankees is the most expensive by salary-wise. Are they the best baseball team? Well, that's a matter of opinion, right? People in Boston will say, no, they're not. So what the hell happened? I paid for all of this baseball and not getting the best. What the hell happened? I'm paying for all of this U.S. healthcare and not getting the best. So that capitalist system is part of the problem. So an answer to that is what other countries do, which is universal health care, which is everybody gets health care no matter what, and they get it for free, air quotes. Again, when they say free, the money had to come from somewhere. It's your taxes. So taxes for these people in those countries are very, very high. And before you say, whoa, no, not for this country. No, my taxes are high enough. Remember, if you go to a country with universal health care, yes, your taxes are higher, but then you pay no medical bills. You go to the hospital, you get the $1 million workup, it's paid for by everybody's taxes. The doctor discharges you and you just leave. You don't stop at the counter saying, what do I owe you? You just leave because everything is already paid for. So the money you pay in taxes, you don't pay in health care for yourself. That's universal health care. Among the developed countries of the world, the U.S. is the only one that doesn't have universal health care. There's no way it's going to happen now with a Republican president and control, but maybe someday in the future. Okay. So, as we close up here, just reminder that there is a patient bill of rights. You should familiarize yourself with it. It's a homework assignment, because you never know, one day you're gonna get sick and you're gonna have to stand up for yourself. Don't let the employees in the hospital run you over, gaslight you. You have some rights, and you need to know what they are so you can stand up for it.